We looked at the combination of Daratumumab, Pomalidomide, and Dexamethasone in our patients treated at Emory in Atlanta. We have published several years ago the combination in patients who are non-Pomalidomide refractory and non-Daratumumab refractory, that this regimen was very effective. In fact, we saw progression-free survivals in that group of over 3 years. We went back and analyzed a larger group of patients, and again, in a retrospective manner, we looked at the outcomes of patients treated with the combination of Daratumumab, Pomalidomide, and Dexamethasone at first relapse, where most of these patients, the vast majority, were progressing on Lenalidomide maintenance therapy. And the most important thing that we found with the study is that despite the fact that all of the patients were refractory to Daratumumab, those patients who progressed after 2.5 years from diagnosis had a very impressive, again, approaching 2.5 years progression-free survival. And it was those patients who had the shorter progression after initial therapy that had the short progression. And people think that one shouldn't use pomalidomide-based regimen after lenalidomide, but what we're learning, and it's not refractoriness to lenalidomide, it's more related to the disease. Did the disease come back early on lenalidomide and then progression? And that patient population, we really might want to think about using alternative therapies. And then those patients who had long benefit from lenalidomide maintenance really do benefit from the combination of Daratumumab, Pomalidomide, and Dexamethasone.